Recruiters calling or texting you nonstop? Want to find the right job without exposing your personal info? Need tools to manage your search all for free? In every industry, there comes a moment when innovation challenges the status quo, ushering in a new era of possibilities. Beginly gets it. They get us. Their platform anonymously matches you with jobs that suit you until you decide to share your info. Customize your job search based on economic factors like salary or cost of living, or non-economic factors like location or nearby stadiums or airports. And their algorithm does the rest, all for free. Ready to find your perfect job? Visit beginlyhealth.com/doctoring. Powered by preference, connected by passion. I didn't get disability insurance when I was a resident. We're going to hear from a fellow physician why that was a bad decision and what I can do about it on today's sponsored episode. Hey, this is Brad Block, host of The Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle. Welcome back to the podcast. On today's show, we have Dr. Stephanie Pearson. She's a board-certified OBGYN and a licensed insurance broker, and that's what we're going to be talking about. She specializes in disability and life insurance for physicians, very specifically disability, and we're going to be talking a lot about why. She was injured in the prime of her career as an OBGYN during delivery, and then she was forced to pivot. There was a lot that happened in between, so we're going to be getting into that. She was forced to pivot, and through her firsthand experience, she found a new calling in advocating for and educating her peers in our insurance needs. So, Dr. Pearson, thank you so much for being on the podcast.
Thank you. Thanks for having me. And please, you can call me Stephanie.
Tell us the story, right, of how you ended up during a delivery and then what happened afterwards.
The very quick story is I got called down to do a precipitous delivery. So my patient didn't get her epidural and happened to be 3 times my size. I typically will tell someone if they're carrying on that I'm going to step back. You can have your baby. I'll fix the carnage. But I looked down and the baby's hearts were in the 40s and the head was right there. So had to get the kid out. As I put the vacuum on and was helping to guide the head out, I got kicked the first time in the brachial plexus. My arm went numb. I started to cry. I shifted my body thinking I was doing myself a favor. I had 6 nurses in the room trying to help me keep her legs back. And when I got the widest part of the baby's abdomen out, I got kicked a second time. And this time she kind of came across my shoulder. 2 of my nurses got hurt. I knew something was wrong, left the room, let my partner finish the delivery of the placenta and whatnot. I got diagnosed with a torn labrum, was told by my first orthopedist that professional baseball pitchers pitched with torn labrums, so I should be able to do my job, and basically was incredibly dismissive of my symptoms. I had a ton of pain. I was losing range of motion. Fast forward 8 months of me trying to figure out how to compensate. And I saw my next doctor who was like, what the, you know what? Textbook frozen shoulder, had surgery, got told I'd be back to work in 12 weeks. Woke up getting told that it looked like a bomb had gone off in my shoulder and I was probably not getting back to practice.
Getting back to practice ever was what they said.
When I woke
time.
up, yeah. I did all the things I was supposed to do in hopes that I would get back, and I never got cleared to do OB or operate. I was cleared to do office GYN as tolerated, but was never given the opportunity. I was terminated unceremoniously the day my FMLA was up because my contract said I needed to be able to do 100% of my duties, and I wasn't. And once I got terminated,
hold on, because
I see the face.
Yeah, like first, I mean, we're humans with relationship with other humans, and certainly we are taught to endure more because it's for our patients, and if we don't sacrifice of ourselves, then clearly we don't care about our patients. But like, you know, you had relationships with people in this department, and physicians are hard to come by. Like, it's so hard to hire. So they had someone that was clearly competent, and yeah, it's preposterous.
It was one of their top producing OBGYNs.
Yeah.
I'd been asked to be the chairperson of our department before I went out, but it was a for-profit hospital and I was just another cog, and I did not see that part coming. And I would probably still be there, to be completely honest. But once I got terminated, I then found out that my orthopedist put in my medical records that I was a liability and I couldn't get malpractice insurance. Now, I have to say he probably did me a favor because knowing me, I would have pushed myself. And I had multiple lawyers tell me that if, God forbid, anything ever happened, I would be indefensible.
Oh, got it.
Because I had range of motion issues.
Yeah.
And I had nerve damage.
But still, like,
it's been a long 10 years, Brad.
But
I'm in a much better
office,
place now.
In the office, and we're going to I want to talk about that because for all the listeners, if they find themselves in that situation, I want them to have this like guide for how to get out. But like, there are specialties where you can do the medical version of it and it's actually more lucrative. So like a for-profit hospital, I would think that they would
you and me both, Brad.
Yeah.
You and me both. The first 3 years were pretty dark. Not sure if you want to get into that or not. I'm happy to.
No, I think it's a good idea. I think it's a good idea because, one, it just paints a more vivid picture for the people out there that might be a little skeptical about getting disability insurance, about what you actually go through mentally when something like this happens to you, right? There's like the loss of identity. So yeah, please, if it's okay.
I have a whole keynote speech on what happens when you lose your identity. So first, from a disability insurance standpoint, I found out the hard way that the group policy that my hospital provided us in fine print didn't cover work-related injuries. So I got flatly denied and told I would have been better off had I fallen off my bike.
Yeah.
Had no idea, right? So that was first knockout.
Okay.
Then I was like, okay, well, it's workman's comp, right? Nope. So I initially got denied my workman's comp because they said, while the injury occurred, my frozen shoulder was idiopathic or my fault because I continued to work while I was injured. So I had to sue the state of Pennsylvania. Thankfully, one of my brothers is a workman's comp lawyer, and his partner was able to help me. And I ended up settling after 14 months, 3 court appearances, one where a vocational specialist said I had the ability to be a coding specialist because I had the aptitude to learn codes. And I sat there in tears and was like, I'm done. Like, I need to get on with my life. I was, at that point, I was actually suicidal.
Oh my God.
I had written letters to my kids. I had written a letter to my husband. I mentally thought that I was better off to my family dead than alive and disabled because I was worth a lot dead.
Yeah.
The guy who sold me my first disability and life insurance stuff, I was grossly overfunded in life insurance. I was underfunded in disability insurance. I didn't actually have what I really should have had. And because my disability is, quote, subjective, right? Because it's pain and it's range of motion, even though
How is range
all
of
the
motion
doctors
subjective?
Don't get me started, because a lot of people lie.
Right. Okay. There's a lot of stuff you can lie about, but yeah.
Right. So I'm like I got myself confused for a second. By the way, menopause brain is real. Everything that everybody says about having a placenta head when you're pregnant only gets magnified in menopause. So sorry, ladies. Yeah, it's real.
Something to look forward to.
Yeah. So I had to sue the state of Pennsylvania for workman's comp. And then
You were in the dark
initially
place.
did.
You were that's where you left the story. You were in a pretty dark place.
So wrote letters, had a plan, and my husband, love him, hated him at the time. He brought home a puppy and said, the boys and I are clearly not enough to get you out of bed. So you have a choice. You can be surrounded by filth, or you can get up and start taking care of something again and get out of the house. And it sounds so trite and so ridiculous, but I found my identity and I got out of my own head at the dog park. You know why? No one knew who I was.
Yeah.
And for the longest time, no one asked. I was Kim's mom, right? You go to a dog park anywhere, everyone knows the dogs' names.
Yeah.
And so I was taking Kim for walks. She's a bull mastiff too, by the way. So she was not a small puppy.
So she was taking you for walks. Yeah.
Right. So I had to be careful because I had to use my right arm, not my left arm. And I would go on these long walks with her and we'd go to the dog park and I was able to get out of my own way. I had just turned 40. So I wasn't even at like the height of my career or the ceiling of my earning potential. And I realized, I think like a lot of physicians, that a lot of my identity was tied up in being Dr. Pearson and being successful in the OR and having patients that loved me, right? And all of a sudden, I was like, what? Now, kind of going back to the disability piece, as I mentioned, I was initially denied. I did have to sue the Well, did we actually get to suing them? No, but I needed a lawyer's help.
You had to lawyer up, yeah.
So I had to lawyer up because they initially denied my claim. And I was like, are you kidding me, right? Everything went through. I got paid. I'm still getting paid 10 years later. I say this often. I don't consider myself a disabled human. I consider myself a disabled OBGYN. You would not want me delivering your wife, your sister, your best friend, and they have a complication, right? You wouldn't want me operating on somebody. Like I kind of joke, kind of not. I bet I'd be a kick-ass robotics surgeon. The problem is I wouldn't be able to fix a complication.
Yeah,
and we all know if you operate
yes.
enough, you're going to have a complication, right?
Yeah, yeah.
I just don't have the dexterity, the strength, or any of that stuff. And then in 2021, I woke up with a frozen right shoulder.
Oh.
So they don't know if I have an underlying connective tissue disease or it's from years of overcompensating for my left. So I have two shoulders that don't work now. But getting back to the kind of the darkness is, you know, there's a tyranny of perfection that exists in medicine, and we're supposed to be stronger than, tougher than, more resilient than, and it's at our own detriment. I mean, I'll tell you, physicians were some of the meanest people to me when I first got hurt because I look normal, right? My arm wasn't in a sling. It wasn't in a cast. I wasn't in a wheelchair. I looked normal. So I'd get the like, what do you mean you can't do your job? Or kick me in the shoulder. Medicine sucks. And I'm like, dude, if you're not happy, leave.
There was just an opto resident who unfortunately died by suicide. And some of the response on social media was like, really, opto? And it's like, what are you even thinking for even a moment? Like, what does that mean? Well, you know, it's not as rigorous, but like, we still have these huge amounts of pressures. People's eyeballs are at stake. You're like, you know, you have to be a perfectionist. It's any specialty. It's a pressure cooker. That's exactly the same situation where, yes, the physicians are the meanest. They're the least empathetic. They're the least, they're the most callous about it.
And I am also trying to change that. You know, every time I talk about my story or talk about other people that I know, I mean, I've created a secret Facebook group called Physicians for Physicians. It's just for physicians who, because of injury or illness, have had to change or leave medicine, to have an actual supportive space and a supportive community, because I didn't have it when I needed it. And the stories are the same over and over and over again. And it's just one of the things that I'm trying to change right now.
So you have Kim the Bull Mastiff that started to help you head out of your funk.
Yeah.
And then somewhere between there and here, you ended up running a disability insurance or an insurance company. So where's that? How do you get from Bull Mastiff to Pearson Ravitz?
So there was a conference called SEEK, SEAK. I am not financially tied to it. It's a conference that gets put on every year in the fall. It's for clinicians looking for non-clinical work.
Yeah.
Somebody mentioned it to me. I don't remember who. I went. I actually got mad because so many people there were unhappy with medicine and burnt out from medicine. And I'm sitting here like, F you all. Like,
Yeah.
I got forced out. If you're unhappy, leave. You know, like it was a very,
Well, that's what they were doing. They were leaving.
But wasn't.
No, but you had it taken from it. You had it taken from you, and they chose to leave. Yeah.
I just wasn't in the right mental headspace exactly at that conference. However, somebody said something that really stuck with me, and that was everyone has a story and everyone has information that could help other people. Find yours. And it didn't click right away. I actually did some med mal defense work for OBs that I felt great about. But in Pennsylvania, you have to physically lay hands on patients. And if you haven't, you time out. Yeah. So I did it for the 3 years that I was allowed to do it. Yeah. And then I was like, oh, back to the drawing board. At the same time, I was doing some medical editing. I was doing some biotech consulting. And I just kept having that little sentence in the back of my head, like, what's my story, right?
Yeah.
And how can I help other people? And how can I still serve? And I had thrown myself into like all things disability insurance because I was like, I felt stupid. I felt like I had let myself get taken advantage of. I didn't do my due diligence and education. Quite honestly, even trying to educate myself, I was like, how does anybody know what this is?
Yeah.
And And I started lecturing to area residencies in and around Philadelphia, really altruistically in the like, here's the mistakes I made, don't make them. And now go on and find somebody to help you, right?
Yeah.
And at one point, again, my husband was like, maybe this is what you should be doing. And maybe there's actually another career here for you. And I thought it was the dumbest thing I ever heard. I was like, I'm not a salesperson. I'm a physician. I don't know anything about insurance. And he was like, Steph, you went to med school, you did a residency, get the books and learn. And in typical type A, I'm older, so I'm going to date myself. I took the books and my magic markers, right, and my colored color pen, locked myself in a room for 6 weeks, took the test, passed, but sat in my car and cried because I didn't get an A. And he laughed at me just like you are right now.
Yeah. Because have any of your clients asked for your score on your... Yeah. Do we even know that you passed the test? Like when we're getting... great. Look, I'm glad you passed. Yeah. So,
right. And he was like, why are you crying? Did you fail? And I'm like, no, but I didn't get an A. And he was like, are you kidding me? He was like, has anyone ever asked you what your board scores were when they sat in your GYN office? I'm like, no. He's like,
that's because you don't practice on Long Island. That does happen from time to time, apparently.
So that's how it started. And it started at our kitchen table. My husband honestly did the back end work. Like he got our LLC started. He got our EIN number. He got our business accountant and our lawyer. He was like, you just do you. Like, start teaching people again. Start educating people again. Do the right thing. And so I was allowed to really do what I was good at. And I did it by myself for about a year. And then my current business partner, who actually was the one who helped me when my agent didn't, and we had been kind of continuously talking, and I was sending him some work and he was sending me some stuff. And when we realized that like maybe we found something that was a good idea, we decided to partner up. So Pearson Ravitz will be 7 this June.
Happy birthday, Pearson Ravitz.
I soon can't say that we're a startup, but it's kind of cool because most companies fail. So, we're doing something right.
Leading a medical practice is challenging. There can be reimbursement changes, referral slowdowns, staff turnover, or drama. There are obstacles in the way of achieving your goals, or maybe it feels like you've hit a plateau. Who can you turn to for help with the business of managing a medical practice? The Physician Growth Accelerator, a private practice partner that helps you uncover and overcome constraints in your practice. They will check your business vitals, identify the root cause of what's restricting your growth, prescribe what to do about it, and help you achieve it, just like we do with our patients. Imagine your practice, where stress is reduced, profits increase in both patients and staff, and you are happier. They've been making that vision a reality for over a decade. Isn't it time your practice thrived? Discover how at physiciangrowthaccelerator.com. So there are a couple of things that are kind of cool that I've heard you talk about. One is that your salespeople are not commissioned, right?
Correct.
And so it doesn't matter how productive they are. So I love that you take that incentive out of it. Now your company is, because you just can't get away from that in the business. It's just how the business works. But that the individual people that are pounding pavement out there are not, it doesn't matter, excuse me, to their income, whether or not I buy from them. I think
I don't even know
cool.
what our commission rates are. I mean, it's a terrible thing for me to admit to as a business owner and the CEO, but our CFO now is my husband. I assume he's not letting me get screwed. And I wanted there to be no question about our company's ethics and that we were truly working for clients to get the best coverage that we could get for an individual person without that looming of you're just doing it to make a sale.
Yeah.
And I think part of that is truly my why is different, right? Like my why is not money, putting food on my kids' table, because honestly,
well, I mean, it should be a little bit since you are both all in.
But you know what I mean.
All in on this, right?
Yeah, we're all in now. He was a flight nurse and a critical care nurse, but it matters. Don't get me wrong. But my why and our why is education and service. And to that point, it's really interesting because we're selling a product that we have no control over. We don't control the product. We don't control the pricing of the product. And we don't control how much we can get people. Right? Yeah. What we can control is education, advocacy, and service.
Yeah.
So to have employees and producers who understand that, who honestly, I feel really good about giving good people good jobs with benefits and security of a salary. Yes, we do provide disability insurance. We provide life insurance. We have great benefits. I have to say, we're a pretty great place to work for. I never wanted that to be something that was questioned.
So the other thing that I think is really cool is, as you said, it's service, right? Because my experience with disability insurance was when I was a resident, there were a bunch of pinstripe suit, sharply dressed salespeople that were talking to what I felt was a vulnerable population, like young, impressionable residents at the start of their career. And the perception that I had was they're trying to take advantage of us. So, why do you think, is it just my own paranoia, or is that perception something that's prevalent among other trainees?
No, there's still a lot of that going on. Again, we're one company that's really trying to change that. I can tell you that aside from my business partner, our producers are not insurance people. We had an MPH who is no longer part of our company right now. Mm-hmm. We had a physical trainer. We have a single mom. we do have somebody who comes from sales, but not insurance. And that allows us to train them up the way that we want them to do it and get rid of that schwarmy, slimy salesperson, right? I'm really trying to change not only the face of insurance. I'm often the only woman at big meetings or one of very few. There are more and more women getting into the space, but really trying to make it more relatable and have it based in education and service. It doesn't have to be rocket science.
And then the sales
It's
follow.
just,
Like
to
you're
your
trying
point,
I want to help you. I have something that can help you. I think a while ago we had Dr. Una, right? Entree MD Business School.
Yeah.
And what she said is the product you don't have to feel like a salesperson because
Right.
you're not. You have something
Right.
that solves a problem. Just tell them that and you don't have to like convince them you just have to educate them, not convince them. So, I feel like the angle that you're taking here. Yeah.
I consider myself an educator.
Yeah.
It's what
I
I
love that
loved
angle.
doing when I was an attending. I loved teaching residents how to operate, right? So I've been able to parlay one of my strengths in a different way. And I feel really good about what we're doing, right? And I don't consider us salespeople. I consider us educators. I consider us advocacies. I don't know if that's the right word.
Advocates.
Advocates, thank you. I care a lot about the underwriting process and have been successful in some changes, not successful in all. I want things to be fair.
Changes, right? The changes that you've seen with specifically female physicians.
Yeah. So when I started doing this, any woman that had had a C-section for any reason would not get their future pregnancies covered. And it drove me nuts because I make breech babies, right? And I was like, what does me having a C-section for breech baby, how does that really increase my risks in another pregnancy? It has nothing to do with if I would get gestational diabetes or preeclampsia or a postpartum hemorrhage or
are they
AVM
showing you actuarial data that says that's the case? Or
come
are
on,
they just
Brad,
like
it's proprietary?
Okay.
Right.
Okay.
But I started sending white papers because what I was getting told initially was C-sections are an abnormal outcome of pregnancy. And I said, no, they're not. Not always. I said, you find me 5 hospitals in the United States that would have let me electively have a vaginal breach. You can't because they don't exist. Find me 20 hospitals that would have let me have vaginal twins. You might be able to find them, but they're hard to find. So listen, put the exclusion as you're not covering complications of another C-section. I'll buy that, right?
Yeah.
You've had surgery or an increased risk for bowel obstructions, for once you've been opened, you have all sorts of risks, right? I'm like, that's fair, right? Like, so at one point, I had all of the carriers on my side, and they started actually looking at why women had C-sections, and they changed the wording for the exclusion. Unfortunately, one of them has swung back, and they've reverted back.
Do you want to tell us which one?
No, I don't ever talk about companies when I do these. However, when I am speaking to someone,
definitely.
If a woman says to me, I've had a C-section, I'm going to say, look, even if this company is the cheapest, I don't want you getting them because I'm an OBGYN at heart. Pregnancy-related disabilities account for anywhere from 6 to 10% of claims a year. I at least get some of that data. And so I want women's pregnancies covered, right? So I'll say to somebody, look, this isn't the right company for you, or you have to understand, right? what is going to happen. So a lot of what I do is managing realistic expectations too.
Yeah.
And I always hate when I get somebody's seconds where, somebody's been declined or not gotten what they wanted with another company because they got to them first. And I'm like, well, duh. Did they ask you these questions? No. That's one that I'm super proud of. Another one, when I started this, anybody who was on PrEP, Truvada specifically, had an automatic limited benefit period. So benefit periods are how long they're going to pay you in the face of a disability.
Okay.
And I basically said, I'm sorry, but this is discriminatory.
Yeah.
And they were like, no, no, no. And I'm like, yes, yes, yes. I want to know who is taking Truvada who is not gay.
Yeah.
And one company was like, oh, we have trauma surgeons and ER docs who are taking it prophylactically. I'm like, they're lying to you. I'm like, I don't know a single heterosexual human who would take PrEP. And this is ridiculous. You're penalizing them for doing the right thing. I'm happy to say that no longer is a ding.
Hey.
So that's another one that I'm super proud of. The other one that I'm super proud of is BMI stuff. So we know that the typical BMI chart that we use currently is based on Anglo-Saxon, Eastern European men. Well, guess what? Southeast Asian women don't fit that. A lot of people don't fit it. Yeah. That just happened to be the subset that I was really focused on when I first went after them.
Yeah.
And BMI is one of the few things that actually adds cost to these policies. And I've been able, now granted, it's not easy. I have to show stability of stature for at least 5 years for the carriers not to add that extra cost.
Sorry, stability of stature. So you have to maintain your weight and they need to log that? So one of their insurance carriers is going to come and weigh me every so often?
No. I have to show old records. So
got it.
Get me your doctor's records.
Oh, something that says that you're not on your way up, right? That this is or
that you're not anorexic, right? Because they're looking at, right, how many, I realize I'm focusing on Southeast Asian, but there are a lot of Southeast Asian women who are both tiny and tiny, right? So they're 5'2" and 100 pounds. Well, if you go by kind of the stereotypical BMI, they're going to come out on the low end. And then these carriers think that they have an eating disorder.
Oh, I see.
Right? And so you can be too big or too small. And we have this whole subset of people that are registering as too small. And I'm like, but they've been this way their entire life.
Got it. I see. So they didn't forgive some of the too big, but instead they are allowing for too small. Okay.
Yes.
I see where you're going there.
The too big, I can't, there's very little I can do on the too big.
Okay.
But the too small was really bothering me because
It's amazing that you've done all of this in the industry. Is one more thing that I want to talk about before we close. And that is because we had a law firm on the show earlier, and what they do is they sue disability insurance companies on your behalf, right? Because if you're not getting your claims paid, right, you need to lawyer up because you had, as you experienced, you had an injury, right? You weren't getting paid. What do? You lawyer up. And you even talk about that. You sell disability insurance and you talk about lawyering up and suing your disability insurance carrier. Now, tell me.
Why do I sell it?
Yeah, no, not why do you sell it? Because you've already I mean, I know where you're going to go, which is no, we make sure that stuff doesn't happen to you. But why doesn't the insurance company get upset with you going on these shows and talking about your experience and basically demonstrating that sometimes you do need to lawyer up? How come they're okay with that?
There's a couple reasons. One is because, God, I'm going to toot my own horn, but we're really good at what we do. And getting people the right coverage with the right language that's going to cover them if they need it. The caveat to that, and I always say this to people, black and white cases get paid.
Yeah.
It's the gray cases that will sometimes be challenged. And I get it. There is so much fraud out there.
Yes.
I mean, I know so many stories. I've become really good friends with my disability lawyer. And, you know, some of the stories that he tells me are almost unbelievable. There was an anesthesiologist who was literally injecting lidocaine into his fingertips and saying he couldn't feel stuff. Well, no shit if you're...
Yeah.
And it took a private investigator to prove this guy was lying, right?
Yeah.
My true feeling, if you are being honest, you will get paid. Some things like pain, some things like range of motion, they're somewhat subjective. And, you know, I want there to be somebody who is trying to prevent fraud. I do. If we want
it saves all of us money.
Well, that's the thing.
It saves us all money, right? That's the...
Correct.
Yes. Because otherwise these policies would be untenable. We'd have to pay tons of money because of all the fraud out there. Yes, there are. Everybody needs policing, even physicians.
Yeah.
But there was something that you said before the show that I want you to say now, because, you know, you help physicians to make sure that the language that we would typically need to hire a lawyer, because it wasn't in there, now we might not. Because it's in there, because it's, I mean, the policy is designed and worded in such a way that we shouldn't
we're protected. Right. I mean, I can tell you, we have had over 24 people go out on claim, and knock on wood, we have not had anybody that's had to lawyer up and go after a carrier. Everyone has gotten paid. I currently have 4 cases pending. They should all get paid. You know, you can't argue with cancer, right? You can't argue with a brain tumor. You can't argue with a femur fracture. Like, the things that we've had, and even like crazy stuff. Somebody who, you know, fell coming out of a hot tub and fractured his coccyx bone, right? Like, we can't make this stuff up.
Hopefully it wasn't at an Airbnb, one of my Airbnbs.
It was not at one of your Airbnbs.
No, I don't have it.
But no, I'm kidding. But
we don't have a hot tub.
You know, it just, I like to think that we are doing a better job of educating people and getting the right policies for them.
Yeah.
And anybody that thinks that they're going to go out on claim speaks to me. They get my cell phone number. I help them with the claims papers, with the packets, kind of what to expect. I tell people all the time, I'm okay being famous. I am not okay being infamous. Everyone has to be honest, right? But just like everything else, if you don't know what to expect, you don't know what to expect. And I'd like to think that the guidance that I give helps alleviate some of that stuff.
Well, so if someone wants to look into disability insurance with Pearson Ravitz, or also life insurance, because you also do that, where do we find you?
We do. So our website is www.pearsonravitz.com.
Well, you did just date yourself.
I am
you don't need to type in the www anymore.
Well, like, I don't know. Do people say that anymore? I'm on Instagram. I'm on LinkedIn. I'm on Facebook. I'm under Stephanie Pearson, Dr. Stephanie Pearson, and I think Stephanie Pearson MD, because now I think there's like multiple accounts. I am the easiest person to find these days. I think I'm even more available than I was when I was practicing.
Well, fantastic. Well, thank you for all the help with physicians, keeping us safe, keeping our families' finances safe, and focusing that all on education. So thank you very much for all that you do.
Well, thanks for having me.
Being contacted by recruiters can be a lot. I've been at the same job for over 12 years and I still get texts and emails, sometimes in the middle of the night. Instead, get matched anonymously to find your right job. Beginly Health is a dating app for your career. To swipe right on your career, visit beginlyhealth.com/doctoring. Powered by preference, connected by passion. Thanks for listening. I have a favor to ask. You listened to the episode until the end, which means you either fell asleep or you really liked the episode. So please share it, or like it, or comment on a social media post, or write us a 5-star review. Something. It would really help me out. And maybe what you learned from this episode can help someone else too. The views expressed in this episode are those of the interviewer and interviewee and don't represent the views of their employer or even their significant other, even though the magic of podcasting make it sound like I'm talking directly to you. This is not a doctor-patient relationship, and this is not medical advice, or financial advice, or really any advice. Thank us again for listening to The Physician's Guide to Doctoring.